a vendor or a product as part of that grant, but other than that, funding should not affect the type of procurement that we do. This is a very busy something we are putting together in our new processes. We are starting to document our process. We are putting together new training, and this is one of the slides we are using that just shows how many steps there are to going through a procurement and when they need to come to purchasing contract and when they need to be approved. Personal services are not noted on here because they are exempt from coming to purchasing contract at this time. They are one of the exemptions. So they aren't on there, but waiver of competition would be one of the processes that does come through purchasing contract. And this specific slide here just showed if there is a waiver, the workflow that would go through. It usually starts internally. When it comes to purchasing contract, there is a need for them to justify the waiver. We have those 18 conditions, but if they would say one of the conditions are questions that are going to be why, why is this the only vendor? Why is this the only one that can do this? Why can't we get competition? So when it comes to purchasing contract, they do have to send that information, that backup that tells us how that was determined that vendor would be a sole source vendor. And as far as dollar limits go, the waiver competition is, the agency delegation is normally $25,000, but less than $10,000. Some agencies are less than $10,000. But when it comes to waiver competition, anything over $10,000 should come to state purchasing contract for approval. Personal services contracts are exempt again from PNC's approval, and agency policy determines the approval authority. I know some agencies do go through their personnel for that. And this is something that might need to be looked at when we do our revision to our rules. Contract amendments must be approved by purchasing contract in advance of all contracts that exceed the agency's delegation. There are no dollar limits for sole source or personal services contracts. And for services per the NCAC 05B.0301, the dates of service of the contract shall not exceed 3 years. So that is another rule that is the 3-year. If an agency wants to exceed the 3 years, they want to go 4 or 5 years, they would also have to get pre-approval from purchasing contract on that also. And sometimes it happens when there's a company doing a startup, and it's just going to be a lot of expense up front. Sometimes we allow a contract to run longer. Is there any questions?
Questions from committee members this time? Senator McKissick.
Thank you, Mr. Chair. I understand the procedures which you've outlined, and I appreciate the fact that you've given us some context to understand the sole source contracts which have been entered into or personal service contracts. But to what extent do you have available this morning, or could you assemble, say, a list of the personal service contracts, the sole source contracts which have been executed, say, within the last 2 years?
We would have the ones that have come through purchasing contract, because we would just be doing pretty much the sole source. Personal services would not come through our office. So we may not have lists of those, but we would have lists of sole source that come through our office.
Follow up, Mr. Chair.
Follow up.
If you could assemble a list of those, if you could, and provide those to the members of the committee, I think that would be helpful and insightful, just to see how many there truly are, what the purposes were, and the amounts of the contract, as well as the time frames over the last 2 years, maybe. So you can do that for which group of contracts specifically?
We do sole source for any state agency, for community colleges, all that come through our office of purchasing contract. We can get you a list of all those.
But not for personal service.
Personal services, no, they do not come through our office. They are exempt from our approval, so we don't have those.
Okay. Mr. Chair, can I ask one additional follow-up, perhaps, to Madam Secretary? Madam Secretary, is it possible for us to know in terms of these other personal service contracts, which ones have been executed, say, within the last 2 years? I think there may be some potential confusion about which contracts are executed with which specific individuals or consultants or entities, so that we can really get an overview of just how many are out there. I mean, I think there's been some that have gotten a great deal of scrutiny, but there are perhaps others that are falling off the radar screen. But is it possible to assemble that and provide it to the committee?
Yes, of course, Senator.
Madam Secretary.
Additional questions from Representative Avila?
Thank you very much. If I could ask, what was the justification or rationale for an exemption of the personal versus the sole? And why wouldn't all of it go through administration? And I guess just for ease of oversight in terms of, like you, Senator McKissick just asked for a list, we have to go to 2 sources.
The personal service, that has just been in the rules since I've been working in state government, and that's over 27 years. So I really don't know the rationale why they were separated out like that. But that's just one of those things that's been a long time, and it's something we are looking at when we redo the rules, because it might be something we do want to bring under purchasing contracts for us to oversee.
Follow-up?
Follow-up.
I'd like to make it a recommendation that we do consolidate those unless there are some extremely solid reasons for not doing so.
Senator Troy.
Thank you, Mr. Chair. I guess since we're on this thread, I'll go ahead and ask. And I'm going to bundle this and then questions, if you will. Curious what overall percent of the business is sole sources is significant enough we worry about. And from the procurement process, can you give us an overview of what percentage of this is automated? Do we have a workflow management system that governs these things and moves them to the right people? Do we have contract management in place? I know the state auditor and another department had a lot of issues that we weren't taking advantage of discounts and all the T's and C's in the contract and how we keep track of that for this department.
We are definitely looking into getting a contract management system. Right now we have IPS, Interactive Purchasing System, it does help us a lot. We can go up and look at by vendor, by name, by agency. It does help us, but it's not newer, it's an older system, so we're looking at updating that. But we have the e-procurement system that we use. A lot of people put their services through there, so we can use e-procurement also to get reports on services that go through that system. Unfortunately, it's like different agencies use different mechanisms. They don't all go through procurement, they don't all go in one direction. So, was there other?
Any additional questions from committee members? No, thank you. All right, we'll move on to the next item on the agenda, which is the department restructuring initiatives, and we'll start with Secretary Bosch.
Thank you, Mr. Chairman. Well, I inherited a department with very well-documented history of serious and chronic problems. And the first thing that I set out to do was to restructure the department with a very strong, very focused leadership team in order to direct the operations of our 16,400 employees and our $18 billion budget. Part of the restructuring was to put into place the first ever CIO, the first ever CFO, and of course to strengthen our internal audit department. I created a leadership team that works together. We designed a structure that is more collaborative. This way, we make much better decisions and far fewer mistakes. This restructuring has made all our programs inside of DHHS better. This afternoon, you will hear about NC Fast, and you will see an example of what this organizational structure really means. You'll hear from leadership in social service, Medicaid, and information technology why because it requires all of these areas working hand in hand to serve the citizens. So many long-standing challenges were created in the department because people did not communicate and they did not work efficiently with each other. And today we will see the results we have seen based on the work of the department and its partners and counties. Also, I've highlighted that we've made a commitment to better oversight and strengthen our internal audit and added new contract and grants professionals with decades of experience. We are making progress. It's a process, and there is still a lot more work to do. You'll hear shortly from Mark Goebel, the Director of Human Services for the department. We all know that recruiting in government is bureaucratic and very difficult. But I commend Mark Goebel and our team from streamlining our internal process and, despite many obstacles, continuing to push for efficiencies. But first, I would like to ask Mr. Chairman if Deputy Secretary Dave Richard, he is Deputy Secretary for Behavioral Health, Developmental Disabilities, and Substance Abuse, to discuss how our alignment improves the ability to deliver mental health services, the integration with Medicaid and Human Services, and how, as Deputy Secretary, he interacts with our support functions, such as IT, HR, and budget. Here, we are now more closely integrated across the entire department. And Mr. Chairman, if I can recognize Deputy Secretary Dave Richards.
Mr. Richards.
Thank you, Mr. Chairman. I think we're going to have another slide that we'll put up here, the next one. We lost the slide clicker, I think. There we go. If you notice, this is the organizational chart that the Secretary is responding to, and again, thank you, Mr. Chairman, and members of the committee for the opportunity to talk just briefly. I'm Dave Richard. I'm Deputy Secretary for Behavioral Health and Developmental Disabilities. And a way of reminder, I've had 30 years experience working in community mental health prior to coming to the department in 15 months ago. It seems like a short time. It's been 15 months. When I started, Secretary Bosch was real clear with three very focused directives about how we work in the department. First of all, it said you do the right thing, and I think that's something that continues to be the message we get. Secondly, that we use common sense, that everything is a common sense test. But the final one, and probably the most important one that she gave a directive to all of us on, is that we have to break down silos. The department has historically worked in silos. I think government is easy to get in those roles, and any big organization does that. But the silos that we were working in weren't delivering the best services for the citizens of North Carolina. So we had to make changes in the way we move forward. So what you see on the screen is an organization that is tightly aligned with both programmatic and support functions that work together, integrate both up and down and across to make sure that all of our departments, all of our divisions, and all of our sections work closely together. What I'd like to do is give you 3 examples of how this works in behavioral health and our efforts that we do around those efforts. First of all, you know that we have stood up a managed care system for behavioral health and developmental disabilities, one that we all work together to get in that point, the LME-MCO system. It requires a great deal of collaboration between the Division of Medical Assistance, Division of Mental Health, Developmental Disabilities, and Substance Abuse Services, our contracts, our legal efforts, and of course our leadership team at the state level. Our goal is that for our vendors, the LME-MCOs, the providers, and the constituents across the state, that what they see is a seamless operational oversight. One that doesn't depend on 2 separate divisions or 3 separate divisions, but the fact that DHHS is providing that effort. What we do is we have leadership efforts. Dr. Cummings and I are meeting on a regular basis along with his leadership team, the DMH leadership team, programmatic staff that work on this meet on, I'd say, a daily basis. But what's most important is that there is never a time where either Dr. Cummings or I don't feel comfortable speaking to the staff on each one of our divisions to make sure that this works. There is no, that's not my section, or that's not my department attitude. It's the kind of work that you would expect and hope you demand out of a government that works for the people, and that's the responsibility we have. It doesn't mean that we don't have specific accountability and responsibility, because everybody knows their job and what they're supposed to do. What it means is nobody stands up and says, that's not my responsibility. Everybody takes responsibility. Secondly, the creation of the position of Deputy Secretary for Behavioral Health and Development of Disabilities is an indication of our responsiveness to how systems ought to work. We definitely need the leadership of Dr. Cantrell at the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services, and Dale Armstrong at Division of Health, State-Operated Health Facilities, because those are really important functions, and you need that management structure. But if we run those systems separately, what we run the risk of is creating a system that is siloed, that doesn't work for the citizens of North Carolina, and continues down a path to where we have separate systems. And we can't afford to do that any longer.